Welcome to the COVID313 Community Coalition for Families and Students Teletown Hall. I'm Christine Bell, a mother of 3 awesome children, honored to serve as the Executive Director of Urban Neighborhood Initiatives, proud member of COVID313 Coalition, and one of your co-hosts for today's Town Hall. We've been at home for 6 weeks, keeping ourselves and those most vulnerable in our communities safe. Many of us have questioned whether we are doing the right thing when it has caused so much struggle and uncertainty in all areas of our lives. The numbers tell us we are doing the right thing for our families and for our community. So let's keep it up and we will get through this together. We're going to get started in a few minutes. We are translating the town hall to Spanish, Arabic, and ASL. So we want to give folks time to get on the right line and get comfortable. Cindy, please share the phone number for Spanish translation.
Si necesitas traducción en español, por favor hable al 313-626-7440, 313-626-7440.
Thank you, Cindy. Saeed, please share the phone number for Arabic translation.
إن كنت بحاجة للترجمة إلى اللغة العربية، الرجاء الاتصال على الرقم 313-241-7030 313-241-7030. Thank you.
Katie, please share the instructions for ASL.
Thank you, Katie, and thank you, Christine, and welcome again to our town hall. My name is Jametta Lilly, and I am blessed to serve as the CEO of the Detroit Parent Network. I'm also a proud member of the COVID313 Community Coalition for Families and Youth, and also your co-moderator for the day. I'd like to let you know that, as you probably have figured out, that this coalition is very much just like you. We're parents, we're grandparents, we're youth, we're educators, we are change agents, and we're coming together weekly to provide you with facts, support, and resources. In a nutshell, we're providing and supporting knowledge, because knowledge is power. And as a community, we can stand strong in the knowledge, knowing that the numbers show us that by staying at home, practicing social distancing, and staying focused on the health of our families and communities is helping, and we can't stop now. No matter the weather, no matter how we may be feeling, we know that these stay safe practices are keeping our families safe, but also helping keep safe our CNAs, our social workers, our sanitation workers, nurses, doctors, janitorial staff, uncles, aunties, pregnant moms, and yes, even our 5-year-olds. Everyone in our beloved Detroit depends on us working together in this knowledge and exercising our power. So today we are going to continue to hear from experts that help build up our knowledge. And also we'll be hearing some wonderful ideas of how we can continue to love on our children and take advantage of the great museums and cultural institutions that Detroit has. And speaking of children, this Saturday, April the 25th, is the Detroit Day of the Young Child. Last year, more than 20,000 families throughout the city of Detroit came together to be champions for our children. And all this was sponsored by the citywide initiative, Hope Starts Here. So please join us for the Hope Starts Here Town Hall tomorrow, and you can go to the COVID313.org website to learn more. So go to COVID313.org to learn more. And very importantly, let's stay safe, let's stay powerful, and yes, hope starts here. Christine?
Thank you, Jametta. Soon we'll hear from David Serrano, an educator at the Arab American National Museum, Sarah Plakta Elliott, Executive Director, Youth Development Resource Center. Crystal Hepburn, Team Lead, Children's Special Healthcare Services, Detroit Health Department. Laura Lefever, Director of Community Projects, Children's Center of Wayne County. Dr. Oveta Fuller, Associate Professor in Microbiology at the University of Michigan Medical School. Dr. Nikolai Vitti, Superintendent of Detroit Public Schools Community District. Lisa Key, Chief Academic Officer at Cornerstone Charter Schools. Tayo Da Silva, Director of Special Education at Cornerstone Charter Schools. Robert Jameson, Chief Executive Officer, Detroit Police Athletic. Tony Paris, Attorney at Sugar Lock. Laura Bokash, Co-Founder at Inner Explorer. Kimberly Boyd, Spirit-Filled Yoga and Wellness. Stay with us for the next 90 minutes so that you can stay informed and powerful, and ask the questions that matter most to you, but also have a little fun. We want to hear from you, so to ask your questions, please use the chat on Facebook or text your questions to 313-288-2082. Again, that number is 313-288-2082. We will have Q&A after each segment. If we can't answer your question today, we are committed to getting the answers to you by early next week. All questions asked today will be posted with answers on onedetroitpbs.org. Cindy, please share the Spanish translation phone number for folks that have just arrived.
Si necesitas traducción en español, por favor habla al 313-626-7440. Hoy la traducción sería por la señora Gloria Rosas y Liliana Torres.
Saeed, please share the number for Arabic translation.
إن كنت بحاجة للترجمة إلى اللغة العربية، الرجاء الاتصال على الرقم 313-241-7030. معكم سعيد ونجوى دحدح. Thank you.
Thank you. Katie, please share the instructions for ASL for folks that have just arrived. To kick us off today, we're going to hear from Cindy Gamboa. Cindy?
Thanks, Christine, and welcome back, everyone. Welcome back to our weekly town hall. I'm Cindy Gamboa. I'm a proud parent of 3 wonderful children. I'm the organizing director at Detroit Hispanic Development Corporation, and I'm a proud member of the COVID313 Community Coalition. Just a reminder, the COVID313 Community Coalition for Parents and Students formed because we wanted to make sure that everyone has regular information on what's happening right now. The logos of these organizations are going to be shown on your screen, and we're grateful that we have representatives from each one of these organizations on the call today. This coalition is here for you, and we're going to continue to have these live town halls every week, every Thursday from 12 to 2 to bring you the most up-to-date information from experts around the topics that are most important to you. We're also going to continue to compile resources that on one site, COVID313.org. Now, I know these times are not easy, but you're doing a good job by staying home, by standing strong, and by staying safe. Now, I want us to remember to enjoy the little things in life. Hug our kids, go out for a walk, and hey, it's not too late to join our Census Sidewalk Challenge, #WeAllCount2020. You just have to go outside, draw big, bright, beautiful messages on your sidewalk, encouraging others to complete their census. Who knows, maybe your neighbors will be able to see it while they're out for their walk, and they're gonna be inspired to complete their census if they haven't done so. If you go ahead and take a picture of it, tag AMO DHDC, you can be entered into a weekly raffle to win a $25 Visa gift card. So hey, let's go ahead and participate. We know it's very important that we complete the census this year. This one action will take you about 10 minutes, but it's going to impact your city for the next 10 years. Areas of education, healthcare, food access, and emergency services. So please go ahead and spread the word, ask your family and friends to also participate. We also wanted to share, invite you all to join a special edition of the COVID313 Town Hall supporting our immigrant communities. We know that these times are difficult for all of our for everyone right now. And our immigrant brothers and sisters are maybe dealing with added stress related to language access, ID issues, and immigration-related concerns or fears. So please join us tomorrow from 1:30 to 3 o'clock on this same Facebook page. We're gonna be streaming a live conversation supporting our immigrant communities. So please spread the word and tell a friend. Now I'm gonna go ahead and pass it on to Arlisa. Arlisa?
Thank you, Cindy. Hello, everyone. My name is Arlisa Hurd. I am an organizing member of 482 Forward, a proud mother of 2 sons, and my family and I reside in the Focus Hope neighborhood, which is also known as Hope Village. You know, you've been joining us over these last few weeks, and for that, we are so grateful. But I know that it's been very stay at home. After all, this is week number 6. But it is very important that we remain home and keep ourselves and our loved ones safe. I know it's so tempting to hang out with friends, host a family barbecue, especially when the weather permits, but the risk is too great. We want to make sure, and you want to make sure, that you and your loved ones are still around so that you can hang out. We will come out of this together, and this will not last forever. So just hang in there. So just want to give you a few stats. As of April 19th, there were 31,424 confirmed COVID-19 cases and 2,391 deaths right here in Michigan. We are in an emergency, yet some powerful members of the legislature are pushing to end the stay-home order in the state of emergency and limit the executive orders that have kept so many of us safe. Over the next 8 days, we as Michiganders are taking action on the issues that matter to us. We're asking our legislature to extend the state of emergency, the stay-home order, and provide relief and safety for all of us, no exceptions. So we'd like for you to join us by emailing or tweeting your legislature and sharing this information and sharing your story. Over the next 8 days, Michiganders are taking action on the issues that matter to us. We're asking our legislature to extend it, to extend the state of emergency and the stay-home order and provide the relief and safety for all of us. We want Michiganders to take action with us to keep our families and our loved ones safe. We're coming together with groups across the state to urge the legislature to provide relief and safety for all Michiganders. We shouldn't have to choose between getting a paycheck and staying alive, or our economic security versus our health. Our legislature can pass policies and keep policies in place, like the stay-at-home order, that allows Michiganders' health and the economy to thrive. So please go to mycovidcommunity.com to join us. Send a letter to your legislator and follow along the next 7 days. If you are on Facebook, if you're on Facebook Live, we can chat moderators that will answer questions and post questions on the Zoom for our panelists to answer. If you are watching from the onedetroitpbs.org, you can text us questions to 313-288-2082. Again, that is 313-288-2082. The rules for the chat may be posted now. So we are committed as a group to posting the answer to questions that aren't answered early next week on our partner Facebooks. We will also post a live recording of this on onedetroitpbs.org. If you would like to sign up for regular updates and to get reminders from our group, please sign up by filling out the form in the chat on Facebook or texting your email to 313-288-2082. Again, that is 313-288-2082. For those of you who may have just joined us, I will have Cindy, Syed, and Katie tell us again how to connect if you are a Spanish, Arabic speaker, or if you need ASL interpretation. So Cindy, can you please share the number for Spanish translation again?
Si necesita traducción en español, por favor hable al 313-626-7440. 313-626-7440.
And Syed, can you please share the number for the Arabic translation for folks that have just arrived?
إن كنت بحاجة للترجمة إلى اللغة العربية الرجاء الاتصال على الرقم 313-241-7030 313-241-7030. Thank you.
And Katie, for the ASL translation? Great. Now I will turn it over to our moderators, Christine Bell and Jametta Lilly.
Thank you, Arlisa. We are excited for the expert panelists that could join us today to share with us the 3 to 5 most important pieces of information that families and students need to know right now. Also, we have some amazing guests that will lead us in some kid activities that we can continue to do at home. For our experts, please remember to speak slowly for our translators. They want to make sure they are translating the important information that you are sharing correctly. Also, turn off your camera when you are not speaking to ensure our ASL interpreters can be seen, and mute yourself when you're not speaking. You will have 5 minutes to share. Terry Whitfield will chat you your remaining time, and if you go over your 5 minutes, Jametta will gently remind you to wrap up. We will be taking questions from our folks out in cyberspace at the end of your segment. Jametta? So I just want to remind everyone, if you have questions, you can ask your questions by typing them on Facebook, live chat, or texting 313-288-2082. Again, that is 313-288-2082. We have moderators on both who are transferring your text messages to the moderators. First up, we will start our webinar focusing on Ramadan, which starts this week. Jametta?
Thank you so much, Christine. We're so very pleased to have with us today Dave Serio, who is an educator in the Arab American National Museum. Dave, welcome.
Hi, Jametta. Hi, everybody. Thank you so much for having me.
You're quite welcome.
So, hello, everybody. My name is Dave Serio. I am an educator at the Arab American National Museum, which resides in Dearborn, Michigan, which is home to the highest concentration of Arab Americans in the entire country. A little bit about our museum before we get started. So we are the first and only museum of its kind in the entire country, dedicated to telling the history, culture, and contributions of Arab Americans. That makes us a really unique place, and we see ourselves as a home for Arab Americans to tell their story and for folks to learn about who their neighbors are. We are also a place where folks can come and learn about Arab Americans, but also a place where we offer different supplies and activities to the community. So if you go to the museum's website, arabamericanmuseum.org, you're able to see a lot of our educational offerings. We do tours and presentations for different organizations. And we also do a lot of kids crafts, which I'll talk about in just a moment. And then we also do film screenings and open mic, spoken word events, and so much more. So hopefully you'll check out our activities, and most of what we offer is free, especially during what's going on right now. So please do check out our website for activities and events and programs. So I'm here to talk about Ramadan. And as we go to the next slide, you'll be able to see the 22 different countries that we highlight as Arab countries, right? So when we're talking about Ramadan, we're talking specifically through the perspective of Arab Americans who connect with one of these 22 different countries. So you can see it stretches over a really large area of Northern Africa and Southwestern Asia, making up 22 countries. So that's just to kind of give you a nice perspective of what we mean when we mean Arab American and Arab world. And then if we go to the next slide, we're going to focus a little bit more on Muslim Americans. And this is something I think that's interesting, is when we think of Muslim, when we think of Ramadan, which we'll be talking about in just a moment, most people assume Muslim equals Arab and that Arab equals Muslim, when that's not the case. You have many Arabs who are Christian, who are Jewish, who are atheist, and other denominations as well. But then you also have many Muslims who are not Arab. So if you look at this chart here, we see that the largest number of Muslim Americans in the United States is actually African American. So there are more African American Muslims than any other ethnic and racial group in the United States. And if you'd like more information on Muslim Americans specifically, the organization ISPU, or the Institute for Social Policy and Understanding, is a really great resource that you can use. So now getting into more Ramadan specific things on our next slide. So Ramadan's going to be very interesting this year. Most folks are used to gathering together in larger numbers and families. It's a very it's a time when the community gets together to celebrate and to kind of join together. So it's gonna be very different this year, as of course we're all in our respective homes. But you do have a lot of folks that are getting very creative with this. So I've heard of some virtual dinners popping up. I've heard of different community events and services being offered online. So it'll be very interesting this year, but still the Ramadan goes on as we're in these very odd times nonetheless. So just some information about what Ramadan is. So Ramadan actually starts tonight. So this is a very timely presentation. Ramadan is one of the holiest months of the year for Muslims. And Muslims actually use the holidays and whatnot are on a lunar calendar, which basically is about 11 days shorter than the calendar that we use here in the United States. So each year Ramadan falls 11 days earlier than the previous year, right? So last year it was May 4th, May 5th. This year it's April 23rd. Next year it'll fall April 12th, if I'm doing my math correctly. So Ramadan falls 11 days earlier each year because the lunar calendar that Muslims use versus the calendar that we have is about 11 days difference. Ramadan lasts between about 29 to 30 days, so it is pretty much a full month. And the reason that Ramadan is the holiest month out of the year is because many Muslims, because this is believed to be the month where God gave Prophet Muhammad revelations, right? This is where the Quran started to be revealed. The Quran is the holy book for Muslims. And this is where you start to see God reveal revelations to Muhammad. So this is a very, very special time of year. It's focused on prayer, family, reflection. So again, self-sacrificing as well. So during Ramadan, you are expected to, if you're able to fast from sunup to sundown. This means no food. This means no water. This means, yes, no water. This means no gum, no Tic Tacs, no, basically you're not allowed to ingest anything until the sun goes down for that day. There are exceptions to this rule, of course. So if you are pregnant, if you are older and you're not able to fast, if you are sick, you don't have to fast if you're not able to. So the rule is if you're able to fast, you should fast. But if you cannot, like you take medication or you're pregnant, or for women, if they are on their menstrual cycles, you are not expected to fast. So there are always exceptions, and it's encouraged you don't fast if you cannot. Oops, and then if we go to the next slide, I'm sorry, I just forgot I don't have control. If we go to the next slide, so this kind of wraps up our Ramadan talk. So each night after the sun goes down, you're able to drink water and eat and do any type of activity you'd like for the most part. And it's called breaking fast. So once the sun goes down, folks go into an iftar meal, which basically means they break fast, they eat together. You can see this picture from the Arab American National Museum's archives that shows people gathering together, breaking bread. This is a really great way to, bring communities together. And so folks break their fast each night with an iftar dinner, and different populations do different things. Most people will break their fast with water and a date, which is traditional. Prophet Muhammad did the same thing. So most people will break with water and a date, followed by a variety of dishes that people will make. And then to end everything on my brief presentation is Eid al-Fitr, which is the holiday that marks the end of Ramadan. So this really, again, brings the holiday to a close, where people, again, celebrate. It's about a 2 or 3 day celebration where, again, families get together, people celebrate religiously, culturally, and things like that. Yeah, so that's Ramadan in a nutshell. You can, of course, do a little bit more research with ISPU that I mentioned. And then the last slide is my contact information. So if you have any questions, feel free to reach out to me, or you can, of course, follow the museum on social media and through our website. Thank you so much.
Yes, and thank you. Thank you, Dave, for sharing that information. We're going to move forward in our presentation, and we're going to shift to have a little bit of a focus on youth. Specifically, we're going to have Sarah Proctor-Elliott from the Youth Development Resource Center. Sarah, welcome.
Jametta, before Sarah gets started, could we just have Dave answer one question for us? It's around what activities are happening in the community to celebrate Ramadan while still practicing social distancing?
That's a really good question. So from what I'm aware of, and I'm sure there's a lot more out there, people are offering like virtual Ramadan dinners. So I know there's talk about people, getting on their webcams and showcasing the foods that they're making and, breaking bread together virtually. I know that some mosques are doing their services through the web. Also, like we're seeing with churches. And then I know there's also some craft activities as well. So you may have seen one of my slides that had like little lanterns that had like Ramadan Mubarak. So people are also putting out, like the museum and other organizations are putting out craft activities for families to do. So lanterns, for example, are a very common craft. And so people are putting out like how to make lanterns out of like construction paper. And that's something that's very traditional during Ramadan. So people are offering like craft activities and things like, and storytelling as well. That's something the museum is doing, is telling stories about like Ramadan as well. So
great, thank you, Dave. And Sarah, we are ready for you. And I just want to remind all the speakers again to please speak slowly for the translators. Sarah?
Good afternoon, everyone. My name is Sarah Plecht-Elliott. I'm the Executive Director of the Youth Development Resource Center. I'm also a proud parent of 2 young children. And our organization is a network of youth programs throughout the Detroit area who are all committed to providing quality after school and summer programming for our community's young people. We know that now all learning is out of school, and we as parents and family members are spending more time guiding our young people's learning while they're out of school. We want you to know that you're not alone. There are obviously many national resources on the internet, but there's also many local youth programs who are creating learning opportunities for your young people during this time when we are quarantined at home. With the support of the United Way for Southeastern Michigan and the Ralph C. Wilson Foundation, we created a website called discoveryourspark.org. And that website is where parents can go to find information about youth programs in your area. We are currently reorganizing the website to focus on virtual programming for your young people. So you can go to the website, discoveryourspark.org. You can also follow Discover Your Spark on Facebook, Instagram, and Twitter. While we're revamping the website, you can follow us on social media, and we are providing links to different youth organizations and resources that are offering virtual learning right now. Here's just a quick list. There are many others, but these are some organizations locally that are offering online programming right now, and all of it free. So there's Accelerate for Kids is offering coding classes. Born Yoga is providing yoga classes, streaming. The Boys and Girls Club of Southeast Michigan has a virtual club experience right now. Center for Success is offering a full day of activities every day, including homework help and help with literacy. The College for Creative Studies Community Arts Partnership Program has art classes. Developing Kids has really engaging videos with all kinds of content, including teaching your kids how to speak Chinese on their Facebook page. Lawn Academy has a new website called iassistyouth.org that offers tutoring support, and then Living Arts and Y Arts also have online art programming. So as you're looking for programs for your young people, still be thinking about what makes a quality program. And we want to make sure that young people are safe. Here's the example from Center for Success. So I mentioned they provide a full day of different types of programming with their staff. So that's just one of the many organizations that are providing learning opportunities outside of school, in addition to what your school may be providing for your young people. So in terms of what to look for, we recommend that you think about safety, especially with online safety, that you are monitoring what the young people are experiencing, and that the organization is thinking about your young person's safety as well. They may ask you to fill out a consent form, and that's a good sign. That means that they are thinking about keeping your young person safe and want to make sure their parent knows that they're participating in the program. Making sure the program's supportive, there's positive relationships, and that they're communicating with you as a parent. And lastly, that they're building new skills. And thinking through what are some great new skills that your young people could be learning during this time when they're out of school. So again, it's discoveryourspark.org. And thank you for the opportunity to provide this information.
And Sarah, thank you. That's important information, because during this time, how do we keep learning? How do we make sure we're wrapping services to support our children and our youth is so important. We also want to let you know that there will be more opportunities to ask questions of our presenters. We're going to have an upcoming health segment, but if you have questions, please feel free to go into the chat, or you can text them now to 313-288-2082. And so we'll move into the health segment right now, and we're very pleased to have returned to us to continue to keep us informed about health is Representative Crystal Hepburn, who is lead for Children's Special Healthcare Services at our Detroit Health Department. Crystal, welcome back.
Whoops, let me unmute. Hi, good afternoon. Thank you so much for having me back. It is my pleasure. So the Detroit Health Department would like to go ahead and share the information about the coronavirus once again. It is quite highly infectious. Individuals can be affected through droplets or saliva. They can also go ahead and receive or have the virus transmitted in case they happen to go ahead and touch different surfaces and individuals are not even aware that they may have the virus while out in the community. The best way to protect the virus is to continue with our prevention methods. Again, we want individuals to wash their hands for at least 20 seconds with soap and water, using hand sanitizer with at least 60% alcohol if they don't have access to wash their hands immediately after. Avoid touching their face, and also disinfect surfaces frequently throughout the day. The virus can live on multiple surfaces for a number of days. Stay inside and minimize any type of errands outside the home, except for the pharmacy, grocery stores, daily exercise, and medical appointments. Anytime you are leaving your home, we ask that you wear a mask or a face covering each and every time. A face covering can include a scarf or a bandana to minimize spread and also maintain your social distancing. Make sure when you do have your mask on that it's comfortably, well fit, and you're still able to go ahead and breathe. We currently have testing still available for residents at the Michigan State Fairgrounds if they require testing based on the doctor's screening. If so, the doctor will require to provide the individual with a prescription. Appointments with transportation is available for $2. We now have essential organizations and essential employees available to have the testing done without prescription. Moving on, we want to ensure everyone maintains their physical health by staying hydrated, drinking plenty of fluids, and make sure you check in with your mental health. Mental health is just as important as your physical health. We want to make sure that you are aware of the community resources we have accessible to us. The Detroit Wayne Integrated Health Network, they are available 24 hours a day, 7 days a week. I've provided their contact number and information along with SAMHSA Disaster Distress Helpline, telehealth referrals from your insurance company to a provider, the National Alliance on Mental Illness. Their offices are closed, but they do have a lot of community resources, as well as the National Domestic Violence Hotline. So all of the details are on the slides. If you have any questions or concerns, please feel free to give us a call back at the Detroit Health Department. Thank you very much.
And thank you, Crystal. And thank you for reinforcing that in this crisis, there's an infectious rate that we need to pay attention to and all the ways that we need to protect ourselves and our families. But also during this time, we need to think about the stress that we're under. And maybe some of us could benefit from talking to someone. And that's why mental health providers are such an important part of our community and our health and wellness. And here to talk to us about resources for prevention is Laura Lefever, who's the Director of Community Projects at Children's Center of Wayne County. Welcome, Laura.
Hi, Jametta. Thank you, and thank you for having me on again. Again, my name is Laura Lefever. I am with the Children's Center, as Jametta said, and I also happen to be the board vice president for NAMI Detroit. So I'm glad that Crystal had indicated the resources for NAMI, which is the National Alliance on Mental Illness, because that is such a valuable resource. One of the things that, as I always have the opportunity to have these conversations, is to remind everyone mental health is not new and existed prior to COVID-19. What we're finding, or what I do want to say is that 1 in 6 children ages 6 to 17 experience a mental health disorder each year. This is prior to COVID-19. As well as 50% of lifetime mental illness begins around the age of 14 and 75% by the age of 24. And those are national statistics. So we always want to talk and support mental health for our children, and even more so now due to the COVID-19 concerns and issues that we have. Just a reminder to everyone is that mental health and mental hygiene check-ins are so important. Mental health is no one's fault. So mental health happens, there's a mental health challenge that can happen to any of us at any time due to trauma-related situations, depression. So those are the things that I want to share today, is to help everyone understand that we need to talk about mental health with our children and check in with them for their mental hygiene. And so one thing that is so important is really to look at and talk with your children, but understand the signs of depression. We are inside a lot today. We don't have those social connections, those physical social connections that we usually do. So on the slide here, it will show you, some of the signs of what depression may look like. And you can see irritability and anger, feelings of sadness and helplessness. Of course, the social withdrawal, they don't have the physical connections. None of us do. We don't really have those physical connections as we do. And you'll see a variety of other signs and symptoms. And so I don't necessarily have time to read them all. And one is not dependent on the other. These are things that I really want everyone to take a look at, not only for their children, but themselves. And know that there are supports out 24/7. The Wayne County Access Line is listed here on the slide, 1-800-241-4944. That's a 24/7 line. If you have a child in crisis and you need to talk to someone, we're available 8 to 8, Monday through Friday. That's 262-1212. That is the intake and crisis line. And they will answer all questions as well and can do a telemedicine screening. And at the bottom, the Detroit Wayne Integrated Health Network website is there. So just a reminder, stay safe, everyone.
Thank you so much for reinforcing again telephone numbers and the availability, not just when we're in a crisis, but when we're having feelings and we need someone else to talk to, as well as for our children. But as we talk about our health segment, we are really so delighted to have someone to join us, specifically Dr. Ovita Fuller. She's the Associate Professor in Microbiology at the University of Michigan Medical School. We're so delighted to have you, Dr. Fuller. Please go ahead.
Thank you. I appreciate the opportunity to be here and to be involved with COVID-313 group. And I just want to share a little bit about the background and fundamentals of COVID-19. These slides will be available. There's probably more info in here than we will talk about today, but they will serve as a resource for those of you who wish to use it. You have my email and my office address at the Department of Microbiology and Immunology. So let's look at some of the fundamentals of COVID-19 as to why we are staying home and staying safe. Here is a slide of definitions, just so we know the terms. COVID-19 or coronavirus infectious disease is the illness that comes from infection with a virus, SARS coronavirus 2. It was initially called novel coronavirus. It is the virus that causes the disease. It started, as most of you may recall, from a transfer from animals, a zoonotic transfer in a province of China back in the end of December. And we've had zoonotic transfers before. We will have them again. Examples are swine flu and bird flu, and then 2 other coronaviruses, SARS and MERS, which had more limited epidemics. They did not go worldwide. The WHO, or the World Health Organization, declared this as a pandemic, a worldwide epidemic, on March 11th. And at that time, there were over 118,000 cases, mostly around the globe, with about 4,000 deaths. And now we're up over 2 million cases, 2 million cases with over this number of deaths around the world. So this is spread throughout the world. And what I want to talk about now, why we are staying safe, why we're asked to remain inside, it's because the transmission of the virus, coronavirus 2, is very It's a virus that's spread through the respiratory tract. So this is an example of two people. One is sneezing or coughing. The other person is standing some distance. If that person is within 6 feet, it's thought that the respiratory droplets that contain the virus can be breathed in by that person and go into their nasal passages in their mouth, or fall on objects where they then touch with their hands. And if they don't wash their hands, they can transfer those viruses into their mouth where they begin, or nasal passages where they begin the infection process. So washing hands and avoiding touching face and remaining 6 feet from others and staying home and sheltering in place are very important to avoid these respiratory droplets that contain virus. This is an example of how easily coronavirus 2 is spread. This was early on in January, where one person went to a ski resort from Singapore to France. They did not know they were infected, but they were what we call asymptomatic shedders. And they stayed in a chalet, a hotel with 9 other people, which ultimately resulted when those people left the weekend after spending the time in the same chalet, in 21 other people around the world getting infected. So people in England, people in France, and people in another place ended up getting infected just from the time, the 2 or 3 days they spent with this one asymptomatic person. This is an example of easy respiratory spread. This is one cluster. Imagine what happens when we go to a birthday party or to a church service or to a funeral or to a basketball event or some event where we're around other people and any one of those people is infected. That's the easy spread of coronavirus. This simply shows the timeline. It can take up to 14 days before the time from exposure to the time of illness shows up if a person is going to have symptoms. The virus shedding begins usually within 2 to 5 days after infection, and the symptoms typically show up around 5 days on average, but it can be earlier or it can be later. So we stay in if somebody thinks they've been exposed for 14 days as a quarantine period to make sure that they did not get infected. There can be clinical infection as well as subclinical infection. So clinical meaning that we see symptoms, mild, moderate, or severe, or there are people who have the virus who are making and shedding virus, but they have no symptoms. The preventions that have been talked about help to prevent transfer of virus for all of these. What does coronavirus do to the body? So we understand. The early symptoms are dry cough, or shortness of breath, or fever and headache, any combination of these. And that's because the virus that entered into the nasal passages is now traveling by replicating on the mucous membranes of the nasal cavity and the trachea. It travels into the lungs. And you can't wash this down because when you drink water or liquids, it goes into the stomach. These things are in the lining, in the cells, so washing them or drinking will not get rid of it. One can go then from a mild to a moderate COVID symptoms. What happens? The virus goes into the bronchi of the lungs, and you see that here, and a battle occurs between the lungs and in the immune system of the lungs, and the virus is replicating on the cells. Someone said, depending on who wins this war, we have either good outcomes where patients recover or bad outcomes where they don't. So there's an inflammation set up by the immune system fighting off the virus in the infected cells. There's cell damage and there's excess mucus that ends up happening in the lungs of the infected person. About 80% of people have mild to moderate or no symptoms. About 20% progress to severe illness, and some of these end up, unfortunately, passing from COVID. This shows you how COVID causes pneumonia. On this side of the slide, we see a healthy lung with open air sacs that breathe in and out oxygen. We take in oxygen to fuel our cells, and we put out carbon dioxide, which is waste from the energy that our cells make. And so the lungs are where that happens. Here we see a lung air sac that has been infected, and now because of the inflammation of the immune system fighting the virus replication in the cells, we see that there's swelling and that these cells are actually clogged up. So this makes it impossible for the person to breathe easily. they labor, they have shortness of breath, and this can lead to what is known as pneumonia. And so pneumonia is fluid buildup in the lungs that leads to difficulty in breathing. For some people, this can be very severe and require hospitalization where oxygen, or even at the most extreme, a ventilator is used. The hospital supports are to try to help the lung to actually function. And so this is what we don't want to get to. This is why we're staying safe. This simply shows you, as one of the last slides, where we are in our process. Here we see the curve that we're trying to flatten. You've heard that term many times. This shows you from the University of Michigan diagram here what the health system can manage without being overwhelmed with too many patients. And this shows you what happens if we don't shelter in, if there's not aggressive stay home means to initially put in place. The virus replicates quickly, lots of people get sick, and we end up here. If, on the other hand, people stay safe and try to stay home to reduce the number and spread of infection, we end up like this. So this is our actual curve in the US. You see that it's not either one of these, it's somewhere in the middle. And fortunately, with the stay home around the country, we're beginning to move into this flattened area where we're hopefully going down. These are the number of cases we have in the US, 834,000 cases known and 42,000 deaths as we stay home, which is why, even though it's hard, it's important to do. So these are the main things that I want to get across. The other slides really reiterate what others have said about the things to do to prevent that spread of virus. And it also shows websites that we can use so that you can keep abreast of the current levels and other suggestions. There's a coronavirus house calls where you can call in questions. And so with that, I will be available for questions in the next few minutes. And our point here is that this is a very easy to spread virus that we want to make sure that we are helping to prevent. Even if we don't get sick and we can be carriers, other people who may be more vulnerable can get sick. And the last slide I'll show you is that this also definitely has a huge impact on different ethnic groups, probably because of many underlying issues and access to health. So we want to minimize these sorts of things and be able to stop COVID. I'll stop here and thank you for your time, and I'll take any questions that anyone may have about the health as well as with my previous presenters. Thank you.
Yes, thank you so much, Dr. Fuller. I am sure that there are many questions. Christine.
So we're just going to ask two questions. I know that there were more than two, but Crystal, this question is for you. A big concern that someone has is around the homeless population, particularly young people. Are there mobilization efforts to provide testing for homeless youth? And would the health department be willing to partner with faith-based organizations to support testing?
Okay, great. I'll start with the first one. So in regards to the homeless shelters, I believe we started testing in the homeless shelters March 16th. We started doing the screening with temperatures, and we've gone ahead and had a team participate and go for screening again in each and every homeless shelter. Once individuals were screened or had one of the symptoms, perhaps it was the fever, they were immediately taken out of the population and put to a quarantine site where they were able to go ahead and continue monitoring, and if needed, they were tested. So we have gone ahead and been very diligent in making sure that we're watching our vulnerable individuals, as well as we've been out testing in some of the long-term care facilities. We've gone ahead and now we've got a team going out for adult foster care and many other organizations. The second part of the question was if we're going to have some, can you read that again just to make sure I've got.
Would you be willing to partner with faith-based organizations around testing?
So it depends at the moment. We don't have testing available for the faith-based organizations. However, we have been participating with them on a number of education calls. We've been trying to go ahead and make sure that we share the information to each and every organization. And we have an upcoming faith-based organization conference call coming up, and I believe somebody was on a conference call on Wednesday with us too.
Great. Thank you, Crystal. And there are two questions for Dr. Fuller. I'm only going to ask one because we know that Dr. Vitti has to get on here and he's got important information to share. But Dr. Fuller, we've been told to cover our mouth and nose, but your slide clearly shows that the virus can spread through the eyes. Why isn't there more emphasis on protecting eyes?
Yes, covering the mouth and nose are really the major areas where the virus enters. The eye is another surface where that is exposed to the air, but the chances there are tears there are other things that can protect the eye. And the cells in the nasal passages are the main one, and the mucous membranes there that the virus is easily replicated on.
Great, thank you, Dr. Fuller. And just to say out loud, we're going to let you think about this one and answer it offline, but folks are interested in your opinion around how schools will be able to keep students and educators safe in the fall. But we'll have you answer that offline, but I just wanted to raise it because I think it's a really important question and on the minds of all of us that have kids,
Yes.
as we're trying to support them at home. And so Jametta, thank you, Dr. Fuller.
Yes, good. Thank you again, Dr. Fuller. And we want to encourage many of you to please review those slides with your families, because this is real. And we need to understand the origins and how we can protect ourselves. But as we're protecting ourselves, we've also got to think about how we are keeping our learning going. And so that is now our transition into our educational segment. And I know that all of you have been waiting to hear some of the wonderful news that has been bestowed upon our families. And so we are so pleased to welcome back Dr. Nikolai Vitti, who is the superintendent of the Detroit Public Schools Community District. Dr. Vitti, welcome.
Thank you. Can you hear me okay?
Yes, we can.
Okay, good. Good to see you. Always thank you for all that you're doing to keep the community and parents updated with everything that's happening. Yes, we made a significant and important announcement this morning. I will say I always worry about our students, our families, how we can do more for them. And today we made a huge step forward, I think, as an overall community to fill a major gap that exists in Detroit and in DPSCD, which is a digital divide. So we announced today that we received $23 million of private investment to ensure that every family receives a tablet and free internet access for 6 months. So we'll start receiving those devices in June. We'll rely on our 19 food distribution sites along with more schools in the DPSCD family to distribute those tablets. So if a student in grades K through 12 was enrolled in DPSCD before March 12th, then they will be able to receive a free laptop and internet access for 6 months. This will allow the distance learning to happen more regularly and consistently. But more importantly, it allows us to continue with learning over the summer through an enrichment way, and also for a way for high school students to gain extra credit or to make up credits that have been lost. And then starting in the fall, students will be able to bring those tablets to school, and we'll be able to expand a bring your own device initiative in the district so that we can do more work online. As we move to distance learning, only about 10 to 20% of our students had consistent access to a device and internet access. So although we developed curriculum, pre-K to 12th grade in reading, math, science, social studies, physical education, and gym, not all of our students could access the material. So although we printed everything out and that distribution started yesterday, this makes a significant investment and allows us to move forward much faster with moving to online learning, which at the minimum allows students to do more learning online through iReady, through Khan Academy, and other online platforms. In the next couple of years, with this investment, we'll be able to move to more of a one-to-one device scenario where we won't have to buy textbooks, rely on workbooks. Things will be online and on tablets, which will reduce our cost to put more funding into other things that we can't do as a district because we have to buy traditional textbooks or workbooks. So it's exciting to make this announcement, and I think it'll go a long way to narrowing not only the achievement gap, which is really an opportunity gap, but allowing our students in Detroit to have the same resources that students have in other districts and cities throughout the country. So I'll stop there. I know that there's only a certain limit as far as the introduction, and then I'll open it up to questions that people have.
Yes, thank you, Dr. Vitti. Yes, I'm sure there are questions, and we're so excited about some reduction, significant reduction of the digital divide that has consistently plagued African-American and low-income children all throughout Detroit and this country, in fact. And so to continue discussion about the resources that are available for education, we're really so pleased to have representatives from Cornerstone Schools to join us. We have Lisa Key, who is the Chief Academic Officer, and also Taiwo De Silva, who is the Director of Special Education. We'll start off with Lisa. Welcome.
Okay,
Lisa, are you available?
I
There you
am,
are.
but it looks like the host muted my video. So I just want to let you know I'm unable to mute my video, but I will start. So thank you, Jametta. Good afternoon. My name is Lisa Key, and I am the Chief Academic Officer for Education for Cornerstone Education Group. I want to start by recognizing the challenges that our families are facing. I am definitely keeping our students, our families, and our city in my thoughts and prayers. One of the things that I am confident of is that the city of Detroit is resilient, and we will get through this together. I am honored to have been asked to speak with you specifically in regards to supports for all of our families who are caregivers for our students with special needs. Special education is my first love, as I spent the first years of my career working in a center-based program where 100% of my students receive special education services. I want to start today by giving you a quick overview of what Cornerstone Schools is doing for all of our students, and then I will have our amazing special ed director, Taiwo De Silva, here to give you more specific information related to supports for students with special needs. We received word on Friday that our COVID-19 continuous learning plan was approved, and we are continuing to implement the plans that we began to put in place shortly after the governor's initial order. We are also rolling out a process to get devices to families who need them in the next several days. All of our families who do not have devices or internet access will be notified on how to receive their device next week. The foundation of our plan includes an advisory model where all 3,500 of our students at all 6 of our buildings, Adams Young, Jefferson Douglas, Cornerstone High School, Lincoln King, Madison Carver, and Washington Parks, are assigned an advisory teacher who manages their individual student learning plan. The advisory teacher coordinates support for each individual student and their family, including non-academic needs related to COVID-19 or other basic needs. Each of our special education students and families are assigned an advisory teacher. The idea behind special education is not to provide students a separate education, but instead to provide supports so that a student can participate in the general education program, which at this time includes our advisory model and individual student learning plans. The advisory teacher works closely with the special education staff to make sure that the student is able to participate successfully in our remote learning educational programming. Key to the success of our plan is intentionally engaging in strong partnerships with our families. COVID provides us the unique opportunity to strengthen this partnership. We are mindful of the challenges presented to families who love and support our special education students. Homeschooling in general can be challenging for all of us as parents, and we are sensitive to the need to provide additional supports for our special education students and their families. In addition to our advisory model, all of our special ed providers and teachers have office hours. Through a platform called Jive, we are able to forward calls from each staff member's office or classroom phone to their laptops. We also have a helpline where parents can call for all types of assistance with special education, tutoring, and academic support, or to request support from our intensive student support network made up of interventionists and professionals with specialized skills. A recent example of our intensive student support network helpline service provision includes a family who lost their husband and a father. This was a large family who were not only grieving the loss of their loved one, but who also had to continue to manage the complexities that have been thrust upon them due to this pandemic. Immediately, this family was referred to one of our school social workers who has begun to do family therapy and support around grief and other issues via Zoom on a weekly basis. We understand that the needs of our students, special education and otherwise, go beyond reading, math, and academics. We are working hard to help address those needs. Lastly, before I turn it over to Mrs. De Silva, I want to share some information about our special education parent and guardian advisory support meeting. The advisory group will be meeting one time per week beginning Tuesday, May 5th via Zoom. We invite parents, guardians, and individuals who are supporting students with IEPs or 504s to join us. At this meeting, we will have professionals who can provide tips and ideas to assist with supporting your child and their special needs. Parents and guardians will also have the opportunity to ask questions or present a call for help. We are hoping that we can provide assistance not only from our Cornerstone professionals, but we can also facilitate collaboration and support among the families who may face similar challenges. Now I would like to turn it over to our Special Education Director, Taiwo De Silva.
Thank you, Ms. Key. Hello, everyone. My name is Taiwo De Silva. I am the Director of Special Education for all 6 Cornerstone schools. I am really, really honored to be part of this forum. So in consideration of the Governor's Executive Directive with regards to special education programs, each district has been required to utilize good faith effort when it comes to the implementation of special education support and services to students with needs, whether it is through the delivery of instruction or delivery of related services, and IDEA timeline for evaluation, such as completion of annual IEPs or 3 years evaluation during these pandemic circumstances. So with these, the Special Education Department of Cornerstone believe it is significant that we must continue to support the educational needs and well-being of our students with needs. So through Wayne Reeser, our ISD, the Special Education Department, which is led by Karen Owl, as well as our charter authorizer, Grand Valley State University Special Education Department, which is led by Cindy Shiski. We have received numerous information and resources, which has allowed us to be able to leverage their expertise when it comes to alternative mode of instruction to support our students. We have been utilizing 3 ways to deliver support and services to all our students with needs, which is based on their IEP, also the individualized educational plan, and of course with our parent support. So the first method is through online learning. Our students with needs, they have full access to connect with all their special education teachers as well as related service providers through Zoom, Google Classroom, as well as Seesaw. These are all video conference mediums. The second mode is through telephone helpline. So students who opt for this means receive therapies, they receive social and emotional concerns from their social worker, homework talk through from their special education teachers via the student's telephone or their parents' phone. The third option is US postal support. So if a student parents opt for homework packet, such a student will receive homework with detailed direction via US mail weekly. This is where our special education staff will mail work to the student's home with self-addressed stamps.
Yes, I am so sorry. Taiwo,
Yes.
I am so sorry. I know the information is important. We have a couple other people that are joining us, and they're strictly time limited. So if
Okay.
I may, thank you so much. And we want to get more of that information that you have. We'd like to
Absolutely.
still make sure that we open up for questions, both for Cornerstone as well as the district. I know we have several, and Christine is ferreting those now. Christine, questions, please.
We have a lot. So Dr. Beatty, come on off mute. Dr. Beatty, there's a couple of questions here. How are schools communicating with families during the summer months? How can the community support DPSCD?
So I think as people should know at this point, we submitted a distance learning plan. It was approved. We've trained our teachers on Teams, which is really the equivalent of Zoom. It's a Microsoft product. Our students know how to log on to Clever, which they then get access to iReady, Khan Academy, etc. So our online learning started with intensity on Monday. So we sent robocalls to all of our families, text messages to families. All of our teachers and school level support staff are reaching out to all parents based on the phone numbers that we have. And so about 50%, I would say, of our students have been now learning at some level online. I think more consistency is probably 10 to 20%. We had about 15,000 packets picked up yesterday, academic packets, and those packets are directly aligned to what is being done online through Teams. So our communication, to answer your question, has been through robocall and text message and phone calls that are being made by teachers and school level staff to parents. So if parents have not received a robocall or text message or calls from teachers, then they can email me directly at nikolai.vitti@detroitk12.org, or their principal, or they can call their principal or call their teacher, and then we'll follow up to try to create a connection.
So Dr. Vitti, this piggybacks off of what you just started to describe. Can you please reiterate for everyone the expectations that DPSCD has for student attendance and completing assignments, and whether those assignments are counted towards grades or not? So could you just reiterate those expectations again, please?
Yep. So the way the grades will work for the third quarter and fourth quarter. So just so we're all on the same page, when school shut down through executive order, it was about March 12th, and we were about midway through the third quarter. So what we've done is, if a student had a D- or higher in their individual class, whether it's high school or their subject areas at the K-8 level, then they will receive a pass. All grades will be pass-fail, but grades that count are only based on what happened before March 12th. So if a student had a D- or higher, they'll get a pass, and that pass will be on their official transcript for the second semester, which encompasses a third and fourth quarter grade. Report cards will not be sent out or issued. It'll just be on the transcript. If a student had below a D-, so an F, in an individual class, then between now and the end of the school year, which is late June, they can participate in online learning academic packets and submit that to increase their grade to pass. But during the distance learning, online learning phase, which is March 12th to the end of June, students may receive, should participate daily. They should try to complete all the assignments, but they're not given a grade. They'll get feedback on completion. You know, this question was right, this was wrong. You can improve your essay by doing this or that, but not formally graded. And those grades will not be included in the third, fourth quarter, or the semester grade. It's all enrichment, but we really hope that as many students participate as possible. And what we want to do is meet parents and students where they're at. There are some students that can do every single assignment or most of the assignments. There are some students whose families are really just surviving and trying to get by right now. We've had parents who have been sick. We've had parents that have passed. We have parents that are trying to manage being at home without employment or with employment. So it can be very stressful, and we realize that. That's why it's all enrichment. But I think, as I said earlier, by giving the tablets to our parents and internet access, it should help facilitate the online learning process a bit easier because we know socioeconomically a lot of our families can't afford a device for learning and internet access. So they may have a phone, but that phone is not ideal for learning. A tablet is, because it's a wider screen and more compatible to accessibility with different products.
So there are quite a few questions about how technology is going to get distributed, and then also looking into the new year, what's going to happen. We're next week, Dr. Vitti or one of the reps from DPSCD will be on, as well as the charter schools, so that they can talk about technology distribution. So we'll hold off on those questions until next week. But for both Dr. Vitti and our folks from Cornerstone, this is a question for next year. So, I think this is on a lot of people's hearts and minds right now, is what plans are in place for principals to address possible symptoms of COVID? And we're assuming this question is, in looking forward to the fall, what are you all talking about in terms of how you're going to keep students safe? So if both Cornerstone and DPSCD could answer, please.
You want me to go first?
Go ahead.
Okay. Yeah, I am optimistic that we will go back to school after Labor Day as planned. I'm hoping that by July we could do some face-to-face instruction for summer, especially for students at the high school level that want to make up credits. Or seniors that have to make up credits to graduate and move on to college life in the workforce. So if and when we go back, we will dramatically promote self-analysis of health based on the symptoms linked to COVID, and hopefully create a sense of awareness among our employees and children that if they show symptoms, they need to stay at home. Now that we will have tablets and internet access, for those children that are showing symptoms or family members that aren't in a place to make sure their children are coming to school every day, we can continue learning at home more readily than we could before. And employees can work from home as well, so they can continue to support students if they're in a state to do that. Our custodial staff will be deep cleaning schools daily. So after the day, frequently touched objects like doorknobs, desks. We are probably also looking at limiting movement in hallways, so we don't have a large congregation of students moving. We're probably going to be separating desks in classrooms and trying to reduce class size even more. Probably look at hybrid schedules so that you're not taking maybe as many classes, so that way we can reduce class sizes, and also relying more on online learning as well. So if again, families, students are not in a place to go to school every day, then we can do more online learning, especially with employees that may have to remain at home too. So those are initial thoughts. A lot of questions are coming in about athletics, so I'll just answer that. I think by maybe late May, June, we can start doing some training, weight training, sprinting, conditioning, and work with our coaches in order to do that in a safe way. But I know how important athletics is to our students and our community, and it's a necessary outlet as long as we can do it in a safe way.
Great, thank you, Dr. Vitti. We know you have to run. Thank you for being with us each week. Lisa, could you provide an answer for the question that we just asked around next year?
Sure.
Thank you.
Already, sure. Currently, we get guidance from the health department when it comes to any kind of illness or things that are going around. And so what we would plan to do is to continue to watch and look for the guidance from the health department, and then build capacity within our leadership teams and our staff through training and other things. Right now, what we're trying to do, the plan that we put in place, we try to intentionally put best practices in place that are best practice, whether we're on the ground or we're virtual. This is kind of our new normal. This may not be our last pandemic. Our world is evolving. And so we're positioning ourselves. So regardless of where we are, regardless of how we have to change, maybe with no notice, like on March 12th, and maybe with more notice that we're going into kind of a flex learning environment or something like that that might come about. We want to be prepared for that. And so by getting devices and getting internet to all of our students starting next week, we're already planning a virtual summer school, regardless of if we're able to go back in the building or not go back into the building. We've already began to train our staff. We're beginning to use best practices like standards-based grading. With standards-based grading, you're looking for mastery. And so it doesn't become about whether or not you get a grade, you pass or you fail. Are the students learning the standards that they need to move forward in the class? And if they are, they're going to get a passing grade for that. We have quite a few seniors right now, 83% of them who are actively engaged in our Google Classroom and Zoom and virtual learning. We are giving them grades because we still don't know what's going to happen when they go to college. A pass, non-pass grade can sometimes impact your grade point average, although I'm sure that our universities will take COVID into consideration. But we're looking at if they're mastering the standards and the content areas of the classes that they need to take, and then what does that equate to from a standard-based grading as far as giving them a letter grade that tells what their mastery level is. And so we're just trying to position ourselves with all of those best practices that should be in place anyway. And we know that our students are at a disadvantage with the technology divide and that kind of thing. And we're trying to position ourselves where we can make sure that we fill that gap and we can move forward and we can train our staff to be prepared for whatever guidance we're given. Thank you.
Great. Thank you so much. We have so many more questions rolling in, Jametta, but I know that we have to move on. Please remember that we're committed to answering all your questions, and they'll get posted, or we can hold them for next week as well. So we'll get them answered. There's a lot. So Jametta, back to you. You're muted.
Thank you.
Jametta.
So to our listeners, thank you. Kind of catch up with the technology here. We want you to know that DPSED and the charters will continue to be part of this on a regular basis. So there'll be more information coming next week, particularly around technology. But we also heard Dr. Vitti speak to something that we know is important to a lot of young people and even adults in our community, and that's athletics. So we're really delighted to have join us is Robert Jamerson, who is the CEO of the Detroit PAL. And Robert is here to talk to us about the efforts that are going to be there to keep our children safe, at the same time be aware of the opportunities for their own physical development through athletics. Robert, welcome. You have 5 minutes.
Thank you. I just want to say thank you to the COVID313 Coalition. This is a great opportunity and platform to be able to inform everyone. And as I'm sitting here, I'm being informed as well. So just truly want to align to share today 2 things. First, the question around when will sports come back? And then also to share an exciting campaign we have to help to mobilize people to get them to be active where they're at in a safe way. So first, our mission is all around helping youth find their greatness. And we're doing that by what you see on the screen right now is helping them to understand the importance of goal setting, resilience, which is definitely needed during this time, embracing healthy lifestyles. You heard many of the people speak to not just the physical effect of activity, but also the mental component, and then accountability. That's where parents and support systems are there to really look at their youth's effort, attitude, action, and behavior. And then finally, teamwork. When you think about this call, it's just as important to impact the child's life as it stands to be able to say it takes a village. So the question number one around when will we come back as far as doing sports programming, we've been really looking at that and partnering with the universities and even watching some of the professional teams think about that. And so our number one goal is to phase back with safety being the priority. That's one of the things that we make sure we do at Detroit PAL. But more importantly, we want to ensure that for our youth and the families that we serve, that is in place. So the first sign that we're coming back will be we'll be training our mentors and then updating our families on the things that they can do. So know that we have a plan that will start up as soon as we get an opening from the city, state, and school systems. And then we have a contingency plan if it's delayed. So we're still doing virtual trainings and things like that. And there's activities that we have on our website that will be readily available for anyone that wants them at detroitpal.org. And so now I want to share quickly just a campaign that we just started. We've launched it last week, and it's really about 6 degrees of separation. It's a play on the number 6, meaning that social distancing doesn't mean social isolation, and it's everyone can get involved and do something, and this is a way that you can get involved. So it starts with being able to reach out to 6 people, and that would be 6 people that you're aligned to, meaning that you're a trusted source to someone, and on the 6th, 16th, and 26th of the month, you'll be able to reach out to them, just checking in to see how they're doing. So as a trusted source, we're now combining that with factual information. So a lot of that's been discussed today around how sometimes so much information is misinformation. But if you're a trusted source, if you align with that factual information, it really helps. So we made it simple. After surveying our constituents, we really looked and found that most people have phones. And so if you pull out your phone right now and you were to enter in 51555, and that's 51555, and enter in PAL, P-A-L, you'll get the information that we're bringing on to you. So first, it'll be information on the pledge, meaning that I am in the fight, I want to do something, and I can do something. So one of the things I'm going to do is reach out and pick up the phone. What we found is that when people get that call, not only is it a blessing to them, but it's a blessing to be able in a position to get the call or be the person that gives the call. So we hope that you participate. It's easy to do. You text the information and they'll get information on employment, services that are available, educational materials, COVID-19 updates. Once you do it once, we'll update them as it goes on. We hope you join in. We love each and every one of you. We know that this is a fight that we have to come together with, and this is one way that we can do that. So I'm challenging each of you to participate. We all can do something. Grassroots efforts is what the community organizations are all about, and we hope you join in on these efforts. Thank you for the platform, and we wish all of you and your families a safe time. So thank you.
Robert, thank you so much. And thank you for underlying that we have to stay connected to each other. And we can bless each other by being a trusted source to share information that keeps us knowledgeable, which means we're healthy and we're powerful. Thank you so much for that. And so what we like to do while we think about being knowledgeable, one of the realities, particularly for many of us in our community, is the reality of how do we economically continue in this crisis? And what are the things that we have to do as we think about unemployment and other resources to help us to ferret out the challenges of the unemployment situation right now. Pleased to have Tony Paris to join us. He is an attorney at Sugar Law. Tony, welcome. Tony, I don't know if you're on yet. We have 5 minutes for you, and we'd love to hear you.
Great. Thank you so much for having me, and for all the members who are listening and tuning in, members of the community and everybody. I'm Tony Paris. I'm an attorney at the Sugar Law Center in Detroit, a nonprofit workers' rights law center. I've worked with your organizations before, and we are here throughout this entire crisis to help answer your questions. If I can't get to them all today, just know that we can be reached either through the internet or through 313-993-4505. Yes, as you said, this is a frightening time for many folks, not only who are now facing unemployment, maybe for the first time, but folks who may be dealing with issues with the unemployment insurance system in Michigan, a system that unfortunately was not built for this type of increase in filings. And I think the most important thing to remember is that the system itself is constantly being adapted and updated in order to process as many claims as possible. Governor Whitmer put out another executive order just today to expand not only resources for unemployed people, but qualifications for eligibility. And the other expansions that she has put in before in her previous 2 executive orders and the federal expansions mean that all of you who are worried or wondering about unemployment should really try to receive benefits. This includes people who have normally been excluded from eligibility for unemployment insurance benefits. 1099 workers, contract workers, self-employed workers. We call it the gig economy, Uber, Lyft, hair and nails in your basement, lawn care, you name it. Anybody who had been receiving any type of income that is not now receiving that because of COVID-19 is potentially eligible for unemployment insurance benefits. That expansion is also going to be but it's going to require some patience on the filer, because pretty much we have an unprecedented amount of filings. We have roughly around 1 million folks who have filed for benefits in Michigan in the past month. To give you an idea, the highest it was during the height of the Great Recession was 360,000. And so that flood of folks means that many people are dealing with a system that's either slow or has crashed. Do not lose faith. Do not stop. Continue to file. Continue to file outside of your regular, maybe business hours. They're recommending after 8 p.m. or before 8 a.m. to file. They're also recommending that you don't fall into 2 important pitfalls that might happen. In the early questioning that you'll fill out, it's going to ask you whether or not you are employed. And it's important that you put that you are not employed or that you are underemployed, that you have less hours if that's the case. Even if you might be furloughed or still attached to your job or just laid off or just on a temporary leave, you're still unemployed. And that one question can potentially delay or prevent you from receiving the benefits that you are later entitled to. Another question that happens a little bit later is that you want to certify that you are available for work. Some folks misunderstand that you are not available because you're at home, perhaps taking care of children, or because maybe you're not available because your job isn't available. You are available for work, and Governor Whitmer has expanded the protections for unemployment insurance folks, where even if you need to be at home to take care of your children, you're potentially eligible for benefits. So in summary, file. When in doubt, file. Give it a try. If you are denied for whatever reason, protest or appeal that. If you are actually somebody who's getting email notifications that you are denied, check your MyWham or your online portal account daily if needed. Go through each tab of your MyWham. Correspondence, claims, notices. Look for anything that might be denying you. And last, certify. Continue to certify even if your benefits are being held up, because your certifications will protect you in order for you to get your back benefits if and when you're eventually able to show you're eligible. And if you need to use the Sugar Law Center to prove that, we are here for you. Thank you.
Thank you so much. A lot of that was great news for many in our community. We have a number of entrepreneurs and people who have been independent contractors and find themselves outside of the mainstream. So thank you so much for that information. And what we'd like to do is to pause and to make sure that if we had any questions, both for Robert Jameson with PAL, as well as Tony with Sugar Law. Christine.
Thanks, Jametta. We have one question for Pal. How can you apply to become a mentor during the pandemic?
Yeah, so right now, if you go to detroitpal.org, there's a section where you can toggle down and you'll be able to see where you can volunteer. You also, if you need be, can reach out via telephone, and that would be 313-510-2399. And if you text to that number, we'll be able to get you and align you to someone in that way as well. So we thank you and appreciate anyone that wants to volunteer during this time. It's definitely needed.
Great, thank you.
Thank you.
So this question is for Tony. Tony, I didn't, the person that's asking received a letter yesterday saying I had to establish my identity by April 27th as part of the application process for unemployment benefits. Without a copy machine or fax machine and reporting in person not an option, what do you recommend for how to accomplish this?
Well, reporting in person has been waived. It's been waived by executive orders, so folks do not need to worry about that. In order to establish identity, if it's asking to attach specific documents, pictures, taking a picture of an identification with your phone, taking a picture of any, perhaps they're asking for any wage records. This can be done by, right-click save as any PDF on a computer that you need to do. But mostly, pictures, as long as they can be attached, should be sufficient. Anything you may have in an old email address, anything that you may have from your, some folks get Venmo or other types of payments to show the money that they get. Whatever can be screenshotted or photos that can be taken should be able to be helpful with that.
Thank you. How long, Tony, do you anticipate the unemployment process taking, or in your experience, how long has it taken?
Well, it's important to remember a couple of things. The first thing is that when you file, you're now in a queue of hundreds of thousands of people. Many folks, when they aren't given benefits right away, make what we've been told by the agency is a mistake and just refiling and refiling, instead of actually waiting and checking for correspondence about your eligibility. From the time that you filed, we are hoping, now that the server was expanded last week, that it won't be longer, it will be weeks at most, a couple of weeks. Recall that it usually is 2 weeks of wait time for employers to submit protests, regardless of, this was the case even before the pandemic. But we're hoping for days to weeks now. We have many folks who not only have just received payment, gig contractors this week, but also received the additional $600 weekly that is now being implemented. It was delayed, but it is now being sent through. I have a few of my clients today that received it, and additionally, that's an additional $600 a week for anybody who's eligible, and another reason why you should try to file.
Great. And then what can we do to advocate for a better unemployment process?
Well, I know that we've submitted some emails, our director, John Philo, and I, to 482 Forward regarding this. It's important that we all remember that the state of Michigan is using a system that has had numerous problems long before this unprecedented crisis hit us. About 5 years ago, they laid off 400 or more claims examiners, the folks who would be the ones who's answering your phone, who's processing your claims, and put in place a system called the MIDAS system. And this system has been the subject of federal litigation that my law office has been in, numerous problems and a high error rate. It is not a very user-friendly system for folks that are using the MyWAM portal. And that system needs to constantly not only be updated and made more user-friendly and expanded, but the governor, who was not, our governor when this was put in place, needs to be reminded that this system and the computer system is problematic, and that the people that she's hired and the folks that she's offered benefits from that were laid off to come back is a very good step. expanding the server is a good step, and hopefully the programming being more user-friendly and also more programmed to not automatically deny or deter people from filing. Those are all important things that we have to keep pressure on the state of Michigan to do, because this was a problem even before we had roughly 1 million people file. And so the system is dealing with really a difficult adaptation phase right now, let's call it, that the governor and all of our state legislative folks need to put resources into.
Great, thank you. And then could you please provide your contact information if people want to reach out to you directly?
Sure. Again, our phone number is 313-993-4505. You can follow any prompts. Our calls are going to be routed to either myself or Shannon Stuckey, one of our paralegals. Bear with us. We're getting a lot of calls, but we'll get back to you as soon as possible. An email even works a little better sometimes. That email is T, like Tony, Paris, so P-A-R-I-S, at sugarlaw, SUGARLAW.org, O-R-G.
Great, thank you, Tony. And this last question is for Robert. Robert, will PAL require people to get tested to play?
At this time, we're, as mentioned earlier, we're still looking at every safety precaution that we can make under the budgets that we have as a youth sports organization. Unfortunately, I know we're probably not going to be in a position like the NFL and other groups. So we will do everything we can to align with what's necessary, even if it means postponing some things until we get it right. So just know we don't have the answers to those questions just yet.
Great, thank you. Jametta?
Yes, thank you. Great information. And now we're going to make a shift. As we talked about in the beginning of the program, we're going to continue to provide facts, support, and resources. And one of the resources that we need is how we can interact with our children and in a way that brings us joy and makes us remember how important we are all to stay connected with each other. So again, with Saturday being Detroit Day of the Young Child, what better way than again to start with those who remind us about finding our inner self, our inner child to explore. So with that, I'm really so delighted to present from Inner Explorer is Laura Bokash. Laura, take it away.
Beautiful. Thank you so much for inviting me. I'm grateful to have this opportunity to spend a few minutes together. So what I'd like to share over the next few minutes is a little bit about mindfulness. Many of you have probably heard about it. Some of you may not have. And so I just would love to share a little bit about what it is, why it's so important, and even begin with a very brief practice. So if you will all just play along with me for just about a half a minute, I'd like to invite you to close your eyes right now or just look downward, whatever is most comfortable for you, and take a slow and deep breath, just breathing in and breathing out. And then continue for 2 more breaths at whatever pace is comfortable, and simply just feeling your body breathe, feeling the abdomen move in and out, maybe the air flow. Just as you're breathing in and breathing out, just stay with those sensations, just a few seconds. Now I'll invite you to just open your eyes again and rejoin me as we move to the next slide. I don't know if I can move the slides or if somebody has to help me with that. Oh, okay, I'm not sure if I have control here. Okay, perfect. So what we just did together is an example of mindfulness. And the idea is that it simply brings us into what we're directly experiencing. And we are working really hard to bring mindfulness into more of a mainstream, into the schools and into the homes, because it can break the cycles of poverty and despair by literally reducing stress and changing how the brain functions. Next slide. I guess I don't have control over it, sorry. So what I'd like to point out just very briefly, this is a busy chart. I will have this, shared with anybody that wants it. But the point is that there are a lot of situations that are beyond anybody's control. As one of the speakers pointed out earlier, there's a lot of mental health issues in the country. They're growing now as a result of the COVID situation. This isn't anybody's fault. Trauma, pandemics, floods, hurricanes, those things are continuing to happen. And, it just is how it is. So the key is, how do we respond to that? And how do we develop resilience in spite of those challenges? And the first way we do that is to reduce our experience of stress. So stress isn't all bad. Sometimes stress is actually good. It helps us focus and engage in ways to overcome situations. But what we're experiencing now with COVID and long-term poverty and those kinds of things, it becomes toxic to the brain and the body. And as a result, it inhibits our ability to think and to learn and to get employment and to succeed in life. And that's what we're trying to affect here. So on the next slide, so I probably had too many slides here. Sorry about that. But I only wanted to point out to the listeners that there's tons of research now that shows that stress inhibits thinking. So just consider that for a minute. Stress blocks thinking, hijacks the smart part of the brain, if you will, and it makes us become more reactive. We don't think, we're just reacting out of habit. And you can probably think back into a time in your own life where you did something or said something that you later regret. That is because you're in a reactive fight or flight mode, not in a higher order thinking mode. And that's what stress does. And over time, it starts to reorient the brain, and particularly in children, if they're in high stress environments, very often, they will become less and less likely to succeed in school, more likely to disconnect or even drop out, which is exactly what we want to avoid. So on the next slide. So mindfulness is defined, and I'm not going to read all this, but generally it's attention to the present moment. Our belief is that every person, including every child, has amazing potential. Sometimes that potential is overcome by situations beyond their control, and that that amazing potential somehow gets sort of downplayed and it's not accessible. So when children practice mindfulness, they begin to understand themselves better, they develop resilience, they become more regulated, and these are the superpowers that will help kids develop that resiliency in the face of challenges, and of course be more ready to learn. So on the next slide. So the main point of what I want to share today is that this type of tool in just 5 or 10 minutes a day is accessible to everyone in Detroit, and in fact, everyone in the country, thanks to several foundations. We're a nonprofit. And so anybody with the email or the web address that's on the page right now can download this app for free. It's for 3-year-olds all the way through high school kids. It's only 5 or 10 minutes a day. It's designed so that it's day 1, day 2, day 3, and so on. So you don't even need to know anything about mindfulness to get started. Just like we began with that few minutes of breathing, it's that, and then it starts to build the skills over time. And as the prior speaker, Robert, was just talking about physical fitness, this is about brain fitness or mental fitness. And we really encourage kids and their families to join in just a few minutes a day of stress reduction as a way to have optimal thinking and manage through this pandemic with greater ease, and hopefully be prepared for what comes next. So I think I'll just sort of stop here as I'm out of time and turn it back over to you.
Laura, thank you very much. And so we want to continue from thinking about mindfulness and having access to ways that we can change our behavior and work with our children, to also thinking about how we move, and how we move can also help our inner selves. And to help us with some of that is Kimberly Boyd, who is with us from the Spirit Field Yoga and Wellness. Welcome, Kimberly.
Let's see, start my video. Woohoo, it's a brave new
Woo,
crowd.
there you are.
Welcome, welcome, welcome. So it's an honor to be here with you to support your practice today, and everything the previous two speakers said, ditto that. I happen to be seated on the floor. Behind me is a chair. And so what we're going to do is to literally put some of those ideas that were just shared into practice. So I invite you, if you've been sitting for a while listening to this fantastically important presentation, it is time to move. So what we're going to do is I'm going to count to 4. And while I count to 4, you get a chance to move your body, stretch it, bend it in whatever way makes sense and feels good to you. Are you ready? All right, here we go. And 1, stretching, 2, bending, 3, swerving, 4, hugging, and just for a moment, see what it feels like to have had a chance just to move your body while we counted to 4, okay? Do you feel more calm and peaceful or less calm and peaceful? Because mindfulness is really about using all of these skills to support your own wellness and to be able to notice and to communicate where you are, okay? So I'm gonna lead us through a simple practice that is about using our creative imagination together with our breath. So the first thing we need to practice is a thing we're getting really good at, washing our hands, but without the soap and water. So just rubbing your hands together, okay? Now we're told about 20 seconds, so our magic number is gonna be 20. So while you're counting to 20, make sure you get the back of the hands. 1, 2, 3, 4, the sides, 5, 6, 7, 8, 9, 10, 11, keep going, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Everybody take those nice hands and notice how it feels. They feel kind of tingling and warm and alive. We'll take one hand and place it on your chest over your heart. We'll call this the heart hand. Take the other hand, place it on your belly. Maybe your belly button is right there in the middle. And for a few breaths, just bring your attention inside and see if you can find your own heartbeat and notice your own breath. I wonder, do you notice if it's short or if it's long? Is it smooth or not so smooth? Well, we can create that feeling of relaxation the smoother our breath is. So let's take a nice, easy breath in. And as we blow it out through your lips, think of clearing a space where you can affirm something really amazing about yourself, like, I am strong, right? Everybody breathe in and breathe out. And say those words to yourself. Sit up nice and tall. I am strong. And how about another one? Think of those words that maybe we're not always all the time on the outside in their behavior, but we know we are inside, like kind. So everybody breathe in and breathe out and think, I am kind, and so are you. Let's not forget that second part. So breathing in and breathing out, I am strong, and so are you. And again, breathing in and breathing out, I am kind, and so are you. And so the invitation is every time you return to that breath, you can drop in whatever strong, positive, inspiring words you care to think about. But taking those nice hands and put them down in your belly, now I want to use the image of a balloon, so that as we take in this deep belly breath, our belly, like a balloon, gets kind of fat, and then as you blow it out, like taking the air out of a balloon, it gets kind of flat. So once again, gentle breath in Your belly balloon gets fat, and when you blow the air out, the belly balloon gets fat. Let's blow it up one more time, breathing in, and let that arms float up to the sky. And just kind of rock from side to side and feel how strong you are at your core, because you can rock forward, back, side, and side without falling down. Or you have to use your muscles, but you can do it. So when something happens and it blows you to one side in life, all you have to do is come back to the middle. And if something happens to blow you to the other side in life, all you have to do is come back to the middle and look up. And if we were a balloon floating in the sky, we might see the sun shining. So everyone take your sun shining arms and just shine your light to one side and then to the other. And don't forget to breathe as you're doing it. So,
and Kimberly, thank you so much for uplifting us as we get ready to close out this town hall. I think we're feeling rejuvenated, and we are with you in the moment. Thank you again to all of our experts and all of our audience. And Christine, please close us out for now, our 5th town hall.
Thank you, Jametta. As we reach 1:55, it's time to wrap up, as Jametta said. Thank you to all of our panelists and for our guests that talked to us about mindfulness and got us moving today. We really appreciate that. And thank you to each of you that have joined us today. If your question wasn't answered, and we know that some were not, we are committed to getting the answers and posting them next week on onepbs.org. Again, we'll be here every Thursday from 12 to 2 to bring you the most up-to-date information. Next week, we'll hear from DTE, Black Mothers Breastfeeding Association, and the medical director at CHAZ. And we'll also hear more from our schools about technology that they'll be providing to families. And there were a couple of questions about that. So stay tuned next week for more info. To sign up for regular updates, fill out the form that's in your chat right now, or put your email or phone number in the Facebook chat, or text it to us at 313-288-2082. Again, 313-288-2082. We know that we can only cover so much in 2 hours. So this week we've started deep dives into areas that you have asked for more information about. So please join us tomorrow from 1:30 p.m. to 3 p.m. right here for an immigration town hall. We do have a few asks of you this week. We want you to take action with us by visiting michigancovidcommunity.com to send a letter to our state legislature to urge them to extend the stay-at-home order and to continue to keep Michiganders healthy and economically secure in this time. Also, there is still time to fill out your census, and we really need you all to do it. It should take most people 10 minutes to fill out. These 10 minutes will ensure that we have the funds for education, healthcare, food, and emergency services for the next 10 years. Please encourage your friends and family and participate in our sidewalk challenge, #WeAllCount. Before you go, we want you to know, and we want to know what you want to hear more about. So please share those topics in the Facebook chat or by texting 313-288-2082. Also, we're posting a survey in the chat on Facebook right now. If you can please take a minute to fill it out. We really want to hear about how we're doing and how we get better. And we will pick 2 people that fill it out to get a $25 Visa gift card. So this town hall is truly a group effort. So before we go, I'd like all of our partners to turn on their videos. I'm going to give you, there we go. And we want to remind all of you out there to please stay healthy, stay powerful, and stay strong. Can we please hear that in Spanish?
Manténganse fuertes, manténganse poderosos y manténganse seguros.
Saeed, can you share in Arabic?
ابقى آمنا، ابقى بصحة جيدة، وابقى قويا. رمضان كريم.
Thank you, everyone. Be well.
Be blessed.
Bendiciones. Thank you, Gloria. Thank you.
Wonderful. Everyone's smiles are beautiful.
We are still live.
Okay.